Hi. Hi. How are you?
Brad, how are you?
Hi, Brad.
On behalf of the rest of the hospital board, which several members are here, physicians, staff, volunteers, I want to extend a very warm welcome to you all today, and I am pleased that you are here to share in this important announcement that will benefit the residents of Trent Hills. It is my pleasure to welcome some of our elected officials who have joined us today. Of course, we are very pleased to have the Minister of Health and Long-Term Care, Dr. Eric Hoskins, with us, and he will be further introduced shortly. Our MPP for Northumberland Quinte West and a huge supporter of our hospital throughout his years, Mr. Lou Rinaldi. From Trent Hills, our Mayor, Hector McMillan, and also a strong supporter of the hospital. The former chair of the hospital board, Kathy Redden, is with us, along with councillors Ken Tully, Ken Morris, Rosemary Keller McLean, I think Rosemary's here, and Bob Crate, as well as staff Kelly Stapley. Thanks for joining us. It's also my pleasure to welcome the Central East Lynn Board Chair, Wayne Gladstone, and CEO of the Central East Lynn, Deborah Hammonds. And please welcome our friends and colleagues from Rouge Valley Health System. Dr. Joe Ricci is here with many of the staff from the cardiac care program. Also welcome to the many members of the Campbellford Memorial's physicians, staff, and volunteers, as well as foundation board members and staff who have been able to join us today, and I apologize if I have missed anyone. Without further ado, please allow me to introduce Lou Rinaldi, and he will take it from here. Thanks, Lou.
Well, I moved out, I moved back out, and I moved back in, and now I'm thinking I'm gonna stay here.
It's a pretty nice place. It is. I've been here once before, but I forgot about how nice that drive is. Is it Highway 30?
Yeah.
You know, that whole drive, and then coming into the town as well. It's pretty
Along the
cool.
river,
And you got pretty well everything you want here and there.
Yeah.
Well, thanks very much, Tim. It's always, as I move to the podium, I have to lower the microphones. When the actor comes up here, I have to raise them. But the good thing today, it's transparent, so you can see me. I don't have to do a sound check. Well, you know, sometimes, you know. Anyways, good morning and welcome to beautiful municipality Trent Hills in Campbellford. And there's only 3 reasons I ever come to Campbellford. Dr. Hoskins, one is for Dior donuts, the best donuts anywhere. One, to visit my good friends at Campbellford Memorial Hospital, and I do all my car business in Trent Hills. So I might get heck for this down the road, but it is what it is. So, and it's a toss-up between the hospital and Dior donuts. Why the real reason I'm here? I know that I can never go home or to my offices without stopping at Dior when I leave here. So I want to thank everyone for joining us today for this important announcement that will help many more patients in rural Ontario, not just Campbellford. CMH is one of the 3 hospitals in my riding that provides outstanding service to constituents. Minister Hoskins, it's my pleasure to welcome you here and to have been able to participate in a tour earlier to meet with some patients. Where we got to see some of the amazing work that CMH does, and certainly I wasn't surprised. It's not the first time that I had the opportunity to talk to some patients. It's my great pleasure now to introduce you to the Honorable Dr. Eric Hoskins, Minister of Health and Long-Term Care. A little bit about Dr. Hoskins was first elected to the Ontario Legislature as the MPP from St. Paul in 2009. He was re-elected in 2011 and 2014. A family doctor and a public health specialist, Dr. Hoskins studied medicine at McMaster University and at Oxford University as a Rhodes Scholar. He then spent nearly a decade as a doctor on humanitarian and war-torn regions in Africa and around the world. He and his wife, Dr. Samantha Nutt, founded the international charity War Child Canada to help hundreds and thousands of children in war-affected regions across the globe. Before his appointment as Minister of Health and Long-Term Care, Dr. Hoskins served as Minister of Children and Youth Services, Minister of Citizenship and Immigration, and Minister of Economic Development, Trade and Employment. Earlier this year, Minister Hoskins introduced his vision for the province healthcare system, Patients First, Ontario Action Plan for Healthcare. This vision will improve the healthcare system for patients and their families, providing better access to the right care, delivering better coordinated, integrated care in the communities, giving people and patients the information they need to make the right decisions about their health, and protecting the system for generations to come through more reporting and more patient engagement. And on a personal note, I had the opportunity in the last just over a year to be reelected and working with Eric. And I can tell you that, I'm not saying that because he's here today, but both him and his staff have been excellent to Northumberland County West. He's never turned away for any issues that we talked about. And believe me, when it's healthcare, there's always issues to talk about. But he's, so Eric, again, thank you and welcome to the podium. Welcome to Campbellford.
Doesn't matter. However you would go. Well, thanks, Lou. And wow, I didn't know this is a big room. It's probably getting pretty hot in here as well. So I see a few nodding heads. I'm going to try and get through this fairly quickly. But there are also some other important people that will be speaking this morning. But it's great, Lou. It is great to be here with you again in your riding of Northumberland County West. And he's right. I'm sure those of you who know Lou know how hard he works on behalf of this riding. And I think relentless is probably not strong enough of a word to describe this man. Most recently, I've been the health minister for just over a year, and certainly, as Lou has identified, there's no shortage of health challenges and issues that need resolution, including a number right here in the riding. And so we are working closely together and with the local LIN as well and local leadership on addressing a number of issues. But it's always a pleasure to be here in such a beautiful part of Ontario. And I was reminded, I have been to Campbellford once before, but I forgot about that beautiful sort of, well, coming up Highway 30, first of all, once you get, it's like everything in Ontario, once you get off the major highways, off of the 401, things turn much more beautiful and enjoyable. But that drive in, let alone coming into the town itself, Mayor, and I'm glad to see you here with us today as well, that this is truly a beautiful part of the province on a beautiful day. But we're also joined by not only Mayor Hector McMillan, who has been involved in a number of issues that are related to health care, and we're going to be talking about one of those this morning as well. But we also, I think, have some council members here with us today, right, Mayor? So I think it's always important for me to identify and recognize, acknowledge, and thank the people that do take the time to come out for announcements or important events. And we do have council members, Kathy Redden, Rosemary Keller McLennan, is that right? Close, anywhere close to being correct? And Ken Tully with us. And of course, Tim Chinette, the board chair, who's sort of taking us through this press conference. Brad Hilker, who is your esteemed CEO and president of the Memorial Hospital of CMH here. And we have John Russell, the Foundation Executive Director of Campbellford Memorial Hospital. I'm joined by Deb Hammonds as well, who's the CEO of the Central East LIN. Wayne Gladstone, the board chair of the Central East LIN, who are local individuals that play such an important part in helping guide us to make the right investments in healthcare and to address both the challenges but also the opportunities in our health system. And Dr. Joe Ricky, who is the director of the regional cardiac program from Rouge Valley Health System. But most of all of you who are either staff or staff physicians, nursing staff, board members, patients, families, and supporters of Campbellford Memorial Hospital. And most importantly, the volunteers, because I know that particularly in small and rural hospitals, the volunteer base is absolutely critical to the success. Now, not just the success of a hospital, but also to the ambience, to the atmosphere that exists in a hospital that provides that welcoming, positive environment that truly does help get people well faster. So thanks, Lou, for your kind introduction, for welcoming me once again to your beautiful riding of Northumberland Quinte West. And I'm so pleased to be here with all of you today for this exciting announcement. And although I'm not from the area, I did grow up in small town Ontario. So I happen to represent a riding in Toronto, which probably couldn't be any more urban anywhere in this province, right? In downtown Toronto, midtown Toronto. And I've represented that riding since 2009. But I'm a bit of a transplant because I actually grew up in the town of Simcoe right on Lake Erie, which when I was growing up had a population of about 9,000 people, a little bit bigger I think than Campbellford, but not much bigger. And was born and raised there and moved on for higher studies like a lot of people do after I turned 18. But having been born into Norfolk General Hospital, that small town hospital, I truly understand the importance, the added importance of our small and rural hospitals that those of us who perhaps grew up in, downtown Toronto might not appreciate, because not only is this hospital so important for providing that quality of care, but it's also a vital employer for the community. It's also incredibly important as an economic driver. And it's also, I would say, equally important to attract people to come to the community, knowing that they can rely on those quality health services, regardless of their age, but certainly as people age and their health needs increase, they want to know and they deserve to have health services that are of the highest quality. So I have a real commitment to small and rural hospitals. I think I have a knowledge and a background that allows me to see them through a slightly different lens than others might. And so that's why I'm so proud to be here today to be part of this announcement. And, I think that, again, when we think of our small and rural environments across these beautiful communities across our province, it's important that we support these hospitals by ensuring that they're able to provide health care services that the community can depend on, but also as many services as possible as close to home as possible, because that's where people prefer, if they have confidence in the health services, if they can get those quality health services, their preference, of course, for them and their families is to have those services as close to home as possible. I was just talking with Jerry, who got his hip replaced a year or so ago and is having some challenges with it up on the first floor, and is getting tremendous support from the medical and health staff at this hospital. He lives in town. He's really happy that he can get the service, the quality service that he needs at this important and difficult time right here close to home. So I'm happy to announce, we're actually making a province-wide announcement here today, Lou and I. So we're here at Campbellford Memorial Hospital, but in a sense sort of speaking to the province, to announce that Ontario is investing more than $7 million, new dollars, in our small hospitals, most of which are also in Ontario's rural communities. And in fact, a total of 56 hospitals and communities right across the province will benefit from this increased funding. And today's announcement recognizes that one of Ontario's greatest strengths is our diverse and strong communities. And everyone in this province, no matter where they live, should hold the same expectations from their healthcare system. They want to know that they will get the help they need when they need it, and that they will have access to the best possible healthcare close to home. Now, last February, I introduced our renewed action plan for healthcare. It's called Patients First. And the title alone, I think, makes its intent pretty clear. Our plan is about putting people in need at the center of everything we do, whatever that need may be, and wherever those people happen to live. And I know that small communities and their hospitals have a unique relationship, that relationship that I talked about, not just in terms of providing care, but employment and economy, and as an attractant to the community itself. Now, there are also unique challenges that our small hospitals face. But hospitals across the province, just like this one, have taken on those challenges to best serve their communities. And I want to take some time to acknowledge the incredible work that Campbellford Memorial Hospital, CMH in particular, has been doing. You've been working in partnership with other organizations like the Trent Hills Family Health Team. I borrowed one of their parking spots this morning. And the Campbellford and District Community Mental Health Center to ensure that the community has access to high quality care as close to home as possible. Now, Campbellford Memorial Hospital is benefiting this year from an additional, and this will go into the base funding, an additional $134,000 this year to help reduce wait times, to provide staff with additional clinical education, ultimately improving care for patients, and further expand programs through partnership with community organizations, I think focusing on palliative care. So I'm honored to be here to announce one example of this expanded partnership right here in your community. And it's separate from the announcement that I just made in terms of the increased funding this year. But I know that Campbellford Memorial Hospital has been partnering and working hard with the Central East LHIN, as well as with Rouge Valley Health Systems and the local council here in Trent Hills on the expansion of a regional cardiovascular rehabilitation and secondary prevention program. They call it secondary prevention because generally speaking it's somebody who's already had a cardiovascular event, say a heart attack or a stroke. But there are things that you can do, and I think we're all generally aware of some of them. There are things that you can do after that heart attack or after that stroke which actually further prevents prevents further harm or can reduce the chances that you'll have another similar event. And this program, the Cardiovascular Rehabilitation and Secondary Prevention Program, it's an exciting program. I know how excited the LHIN is about this as well in Rouge Valley. Where's the good doctor from Rouge Valley? Right here. I said hello. I should have. We should have exchanged business cards, and then. So we're gonna hear from you in a minute, right? So I'm gonna pull back a little bit from what I was going to say, other than that this rehabilitation program is truly exceptional, and to the credit of Rouge Valley and with the support from the LHIN, this is a program that is expanding because it's a proven program that is having a tremendous impact in improving outcomes for the individuals that it's helping. But this program is coming to Campbellford, and it's opening in August, we believe will operate out of a brand new facility, the amazing facility, the Hastings Field House. And I want to congratulate the community on actually making that legacy, that incredible facility happen. That's an amazing example of what communities can do when they set their minds to it. So at the Field House, this will be a center, a facility where patients with vascular disease will have access to fitness testing, weekly education and exercise classes, and much, much more. This is great news for local residents who will be able to access high-quality cardiovascular rehabilitation services right here in the community. So it's exciting news. And I'm going to add, and I can only do this because I'm not supposed to say that somebody will complain to the Minister of Health, and I guess that's me, so I should be all right. But there's also, we have a thing called the Transformation Fund, which is a $20 million fund which is available to hospitals, small and rural and northern hospitals only. Recognizing the unique challenges that they face. Can I say this? Can I at least, I know this isn't public yet. So Campbellford, I know you know this, so Campbellford, CMH is going to, in addition to what we've been talking about, will be receiving over the next 2 years an additional more than $300,000 through this transformation fund to enable, and I'm going to have to leave it to your president and CEO or somebody who knows the details of how that will be spent. But it's an important fund, and these are monies that can be used for specific issues and challenges and opportunities that the hospital faces. So, ladies and gentlemen, I'm going to wrap up with that, and just to emphasize the importance of having all of our care partners, our healthcare partners, working together, working in collaboration, and the cardiovascular program, the rehabilitation program that I mentioned with Rouge Valley is an example of that. The work that's being done in collaboration with the family health team across the road as well, the mental health work as well. All of it is exactly what we mean when we talk about patient-centered care. So it makes me incredibly happy to see that this area is a living, breathing example of that. So I wish this hospital and this community many more years of providing quality care to the community here. Thank you very much.
Check 1, 2, check 1, 2, 3, 4, 5, so good. Check 1, check 1, 2, check 1, check 1, 2, check 1, 2. We're good?
Because I saw his name and I went.
Thank you very much, Minister Hoskins, on behalf of the board, the staff of Campbellford Memorial, and the residents here. Very exciting news, very great news, and I'm sure your dollars will be well spent, and Brad looks after purse strings very well here at Campbellford Memorial. Very much appreciate you coming and tell us this. I'd now like to ask Mayor McMillan to come up and say a few words.
So I hear the good news is that you got a new hip, right? But the bad news is you had a bit of an infection in it, is that right?
What do you mean a bit?
Is it bad?
Bad, yeah, that's what I hear.
Yeah.
They're trying to get it off, and well, I tried at home, it didn't work. It got worse, so I get back home here.
Thanks very much, and Mr. Welcome to Campbellford, Trent Hills, the center of the universe. I believe on my term on council, you're the fourth Minister of Health to welcome here, and we're always very pleased to see you and your government's support for our hospital. And of course to Lou, who never seems to come to CMH without the check. Thanks very much. And of course, members from the Lynn and Rouge Valley, welcome to Trent Hills. You know, there's many things I'm proud of what we've done in the last almost 12 years in Trent Hills. But outside of the municipal projects and infrastructure replacement, a lot of that stuff's not very sexy. There's nothing more I'm proud of than my home here at CMH. And the fact that many of my younger schoolmates are working here. Very proud of those who have stayed here and made the CMH their career, and of our local Trent Hills Family Health team, where recently when we, although we haven't officially unlocked the door of the field house in Hastings, we did hold a grand opening because we had to meet Colonel Chris Hadfield's timeline, and we were very fortunate that he was able to join us and do a grand opening. He said something that's given me a pause to reflect on. And not unlike myself, he speaks his mind, and a very nice gentleman. He said to us at the opening, picture waking up in the morning and getting dressed for a regular day's work, and going to work and putting on your spacesuit and going up the elevator and getting into your rocket ship and thinking, gee, by nightfall I'll be effortlessly floating around the globe, or I'll be dead. There's only two options in my business. And it was very, very blunt, and it's very true, very effective. And I often think that after 20 years of going without an annual checkup, I thought that it was about time, and I went to our local family health team, and I was very fortunate enough to run into nurse practitioner Divinity. Had I not got up that morning and made that decision to make that appointment and go there, I'd be dead. And had I not come here on her recommendations to send me here, there, and everywhere, and see Dr. Suchi Lam, I'd be dead. So there's a lot of things that I personally have connections to CMH, and I'm sure many of you do as well. Maybe not quite as critical, maybe it's just been bumps and scrapes and stitches, and I've had lots of those here too. And all my kids were born here, and the fact that I was born here. It's important, as you allude to, Mr. Minister, that healthcare services go to where the people are, because we can't expect everybody to live in Toronto, where they have a myriad focused downtown in the hospital square there of fabulous hospitals, and lots of other hospitals around the perimeter. And when I lived in Etobicoke for a short time, it wasn't far down the bottom of the West Mall that I attended that hospital a couple times. We do have a fabulous healthcare system, and it works when we need it. And it certainly did for me and everyone in Kingston at the Southeastern Cancer Center. It's critical, and I know, Lou, that you've always supported CMH. And it's critical that they receive those additional funds and to realize that they face the same pressures that all businesses do, that all municipalities do, that all governments do, all levels of government. The increasing in cost of hydro, the increasing of labor, the maintenance of bricks and mortar, equipment replacement, and so on. And Trent Hills has been a great community to step up and fill those roles from the citizen along with the foundation here and the auxiliary, to supporting those needs, to fill those gaps where, frankly, governments just can't do that. And Trent Hills Council has supported CMH over the years, and I'm sure we will continue to. So it's great to hear this funding announcement today. It's great to be a partner, and that's what it's all about, because if we want good health care, we gotta be prepared to step up and fund it, in whatever form that means, and in what we can afford. And we all realize that not everyone can afford to do what others can, but if we all participate, it all works for us. That's what makes the whole system work, and I'm sure that's the way it's gonna have to be. It's gonna have to continue that way. We just can't continue to travel to major urban centers when critical needs are now, where seconds count. It's so important that we have at least basic facilities here, and we can always go on if it's somewhere else, if it's something that's to a hospital that's focused on a particular need. So I'm very happy that you come today to be with us for this announcement, and very pleased with your support for CMH. As we grow older, you know it's our fault with our improved healthcare system and the improved technology. We're living longer. We need to recognize that we're going to have to look after us longer. So thank you for doing that.
Redecorated in line with there's a document to do with seniors called Code Plus.
Right.
So all of our decor is all done.
Thank you very much, Hector. Words well spoken. I would now like to ask Dr. Ricci to come forward. Dr. Ricci is the vascular health physician lead for the Central East Lynn, as well as the director of the Regional Cardiac Care Program at Rouge Valley. And he's here to speak further to Dr. Hoskins' other announcement.
Yeah.
There's only so much money and all I don't care, everybody wants money. So, like they're talking about, I think you know, they're talking about trying to get a new hospital, that's fine. But that's gonna cost a lot of money.
Yeah, it costs a lot of money to do. We want to make sure that in the meantime, we continue to make sure that this structure is really good.
And this is, it's not cheap, I mean, anything you do today. I don't know where.
So we want to make sure we keep up with the times too, with today's technology, right?
Well,
That
you
it's no
have to,
longer-
you have to, or you're out of the game.
It's a pleasure to be here. I got here an hour early too and went for a walk along the river because it was a beautiful day and I had time to spend. And I guess I accidentally went to the best donut store. I was sitting at a coffee and sit outside for a day for this to start, so I guess I got lucky on my first day here. Mr. Hoskins, Mayor Millen, and invited guests, it is my pleasure to be here. We have come a long way as a province from the cardiovascular perspective together over the last years. As you know, today cardiovascular disease is no longer the #1 reason for Ontarians to suffer disability or death. Our efforts in terms of prevention are now well established to have had significant impact on the health of Canadians and have significantly contributed to the improvement in the health of Canadians that has led cardiac disease no longer to be the #1 cause of death in Ontario. Providing a regional system of cardiovascular rehabilitation, secondary prevention, as the Minister mentioned, here in Trent and across the Lynn, improves access to an essential service. A service that we have evidence improves the health of Ontarians and actually reduces their risk of being hospitalized or dying. We're here today because of more than decades of leadership, remarkable leadership by our community, the Minister of Health, our Lynn, and community healthcare providers, including patients that have made this increased access to cardiovascular care a reality. It was more than 20 years ago that a patient, Phil Diamond, a resident of Whitby, wrote a letter to the board of the Rouge Valley Health System asking why he had to leave his region to receive this care. It was that question that led our board to choose to develop a community-based cardiovascular rehabilitation service. And that's the initial step that put us on the path we're here today. I'm grateful to the Ministry of Health for their support of cardiovascular rehabilitation secondary preventative services, because putting patients first in this way is a shared vision that contributes to the health of all patients in Ontario with vascular disease and increases the promise of a healthy future as people age. I'm also very appreciative of the ministry and the LHIN because they chose to support a vision for a different model of cardiovascular rehabilitation services, a vision that transformed cardiovascular rehabilitation services into a regional model of care that puts the needs of patients first. A system that's designed on the principle that every patient should have optimal access to care, which we've accomplished through novel measures, including common standards for referral to cardiovascular rehabilitation, centralized access, centralized acceptance for referral, and booking into a service that's potentially life-saving. We've evolved to a system of care that's no longer focused just on patients with heart attack, but welcomes all patients with vascular disease, whether that be stroke, complex diabetes, peripheral vascular disease, renal vascular disease. As is now well established, the presence of vascular disease increases risks for patients significantly. And whether it's cardiac disease or stroke, access to these kinds of life-saving services is a critical health need. This community-based service reduces the barriers to access by providing multiple sites close to where people live or where they work, not close to their hospital or healthcare providers. We currently have 11 community sites across the LHIN that bring the promise of improved health care closer to reality, and for the majority of patients mean that this facility is not more than 30 minutes from where they live or work. We also have in place a regional infrastructure that provides effective evidence-based care by a regional staff in a standard way so that every patient in our region can be assured that at whichever the 11 sites in our region they receive their cardiovascular rehabilitation second intervention, they'll receive the same care, the same standard of care, and the same benefits that would occur regardless of location, gender, socioeconomic status. We have a system that is increasingly connected now to our healthcare system. The minister's spoken previously about connection. We've worked very hard over the past decade to ensure that not only are patients linked automatically to cardiovascular rehabilitation services where needed at the point of first diagnosis, whether that be admitted to hospital or at their first visit with their family physician, but that process is simplified and automated through integration through hospital pathways and primary care delivery systems. But not only that, once the patient enters this regional service, which is delivered over a 6-month period of time, we have strategies in place to communicate with their family physicians to amplify the quality of care that goes on where their care belongs in the community. And finally, because the value of a service should be based on evidence, we're very grateful to the ministry, the LHIN, and Rouge Valley for actually investing in the evaluation of this service so we can understand both how well it functions as a service, but whether this evolution as a system of care actually offers the advantages we believe are inherent to being a system rather than local delivery sites. So on behalf of our regional team, the LHIN, Rouge Valley, I'd like to thank you for this opportunity today and the opportunity to serve your community. Thank you very much.
Thank you very much, Tom. On behalf of the board, the president and CEO, Brad Hilker, I'd very much like to thank the minister for coming to Campbellford today and sharing this news. Hopefully Lou can guide you to past doers because everybody keeps talking about it. I mean, he knows the way in his sleep. Here at Campbellford Memorial, we strive to be recognized as a leader in rural healthcare. We are creating new opportunities to collaborate with our community partners as a rural health hub, and will enhance the quality of care and improvement access to the growing community we serve together. This additional funding will certainly benefit the residents of Trent Hills and surrounding area, and we are truly thankful. We also look forward to working with our partners at Rouge Valley to support the implementation of the Cardiovascular Rehabilitation and Secondary Prevention Program located at our brand new Hastings Field House, and ensure its success as we collectively work to improve the health of the residents. The details of how everything's going to work at the field house are in process and will be worked out as we move along this road. Ladies and gentlemen, thank you very much again for joining us for this exciting day. This ends the formal portion of our this afternoon now.